Yeah, hello everyone. Can you hear me?
Yes, we can.
Oh, okay, so let me just start. So the topic is a little bit broad. It's a topic that cannot be discussed in 20 minutes, but I'll try as much as possible to at least streamline um the information that you really need now. And then if you need other information, you could reach out to me anytime. So we'll be talking about artist susceptibility to physical illnesses and how to be conscious about it. Health in general, as we all know it, is increasingly regarded as a serious issue in the art or creative community about incurable diseases and professional related injuries. And these have brought these issues into new focus. And so health is good health promotes productivity. And so the point of we talking about today and me sharing some information with you as regards health is to encourage good health amongst you professionals as regards artistry and creativity. So what are the main causes when we look at an artist, a professional artist or a professional creative? What are the main causes of ill health or the physical health disorders? What do we want to look at? Where do we want to find the causes of these problems? So I decided to divide it into two: predisposition to nature and predisposition to environment. And I'll be explaining that further. So there are cases where, due to family history or due to the way you are born, genetic makeup, we are predisposed to some illnesses, we are predisposed to some diseases, we are predisposed to some disorders. And so it's more of like family history. So we're not going to be talking a lot about that. Where I'll be coming from is the one of the predisposition to the environment, where your skills can expose you to different physical illnesses in general. So let's talk a bit about health maintenance culture. Is there a so I decided to also divide the health maintenance culture into three, where you need to ask yourself some questions. The first question you need to ask yourself is there a health problem already? Like, do you have a health problem you're working on? Do you go to the family physician, or do you go to see a doctor regularly because of a health problem you're already working on or you're trying to manage? Do you have a health problem that you're seeing a medical professional for already? That's the first. The second is, now let us identify if you are at risk of any health problem. So depending on your skill work, whether you're a photographer, whether you are a visual artist, whether you are a programmer and the likes, and depending on your skill work, you might be exposed to some health hazards. So that's majorly where I'm going to be focusing on today. And the third you'll be asking yourself is prevention of further health problems. Oh, okay, so do you have health problems that you're already working, you're already trying to manage by going to the medical professionals for help? If you have those, how are you helping yourself to prevent further complications that might arise from it? Or you are skilled at your work. What are those hazards that you're exposed to that you have to take care of so that it doesn't cause more health problems or more complications? So let me just share a bit of natural predisposition, but that's not what we're actually going to be talking about today. But natural predisposition can actually affect how we work and can actually affect our productivity as regards to our skills. An example is there's family history of hypertension in your family, and you might not know about that. And so one way or the other, the disease gets to you. So in the family, you're actually the one hypertensive, but unfortunately, you do not know because maybe you don't go to the hospital regularly, or you don't even know how to check your blood pressure. Fortunately, there are technologies where you can actually wear a wristwatch now, and then you can actually decide to check your blood pressure whenever you want to check your blood pressure. And then when it's high, the wristwatch advises you to go to see a medical doctor. But let's just pretend as if, okay, you know what? This person has a family history of hypertension, and he or she doesn't know that he or she is hypertensive. And so he or she lives with hypertension for a long time, and then it becomes complicated and so affects his or her work. And so you see how natural predisposition can also affect our productivity, not just hypertension, diabetes, and the likes. And so that's why I decided to also at least explain natural predisposition to a little bit. So let's talk more about the environmental predisposition, and let us call it stressors. And so the reason why you have headache, the reason why you sometimes you come down with fever, you come down very weak, you come down feeling nauseous, or feeling like nauseous means that maybe you feel like you want to feel like vomiting and so on, because your body is trying to help you regulate your body system. And in so doing, sometimes those stressors come out as signs and symptoms as regards our health. And then what are those signs and symptoms that we notice sometimes? So that would be more of questions and answers. When we get to the question and answer, I'll answer that better so that I can really understand some of your complaints and some of the problems that you might be facing. So let's talk about the health problems now. So I also decided to make it very easy so that you people can relate to my presentation by dividing it into different types of artists and what they might be facing, what you can be exposed to according to your skills. So the artist who works with his or her body most times come down with nutritional practices, and then sometimes these nutritional practices that they practice, rather these nutritional habits that they practice can affect their physical body. An example is that you see people having not eating regularly, not eating enough vitamins and a lot of other things. And those things can predispose us to having nutritional deficiency, which can affect our physical health in general. Or about eating disorders too. An example is people that dance, ballerinas, and a lot of other people. They want to keep fit. So most of them have not so good healthy eating habits, except those people that maybe they have a dietitian that is helping them to tell them, okay, you know what, eat enough protein, reduce your fat intake and the like. So one way or the other, they most of them have very bad eating habits, unhealthy eating habits. So most times you see them having to come to the hospital regularly. Maybe they were dancing and they fractured their bones. And people don't actually understand that food actually gives us enough energy, not just energy, gives us enough vitamins, not just vitamins, gives us enough framework to be able to strengthen our system. An example of the system is our bone framework. So our bone framework is meant to be very rigid because of the food we're taking. But when we don't take enough food to be able to help our bone framework, like enough calcium and the likes, we will easily hurt ourselves by maybe getting to repeat fractures and so on. There's also menstrual irregularities. There's scoliosis, where a dancer or anybody who uses his or her body anyway to express art gets to doesn't follow the necessary things. Like, okay, let me give an example. I want to go for an audition, and then I need to practice at home. So while I'm practicing before I go for the audition, I don't know that, number one, the first thing you have to do is actually like warm up, get your body to understand that you're about to dance. Now you just go into the dance, you will easily have body framework issues. And I've already mentioned stress factors, so I won't want to delve into that further. So the next artist is the artist that uses his hand, mouth, and voice. And so a lot of times people come down with overuse syndrome. What does overuse syndrome mean? Overuse syndrome is just, let's say an opera singer keeps singing over and over again without actually following the necessary tips to be able to undo such tones. So, you know, when we talk or when we shout or when we scream, we use our vocal cords. And so most times people that sing regularly without exercising their vocal cords whenever they are meant to get to have this overuse syndrome. And so the depth of their voices might be lost in the long run, and so we reduce productivity. Another thing is neural impairment. There's also focal dystonias, where the vocal cords or the nerves that supply the vocal cords can be affected. And so maybe I want to decide to create a vibrato vibrato. I won't be able to create the vibrato. Then there's also for voice problems and many more. So the next one is the artist who works with industrial materials. This is actually the most significant, because a lot of artists actually work with industrial materials. And so most of them come down with skin problems. Most of them come down with cancer. It might look like it's far-reaching. Why will I mention cancer? But I would explain further. Most of them come down with cardiovascular problems like hypertension and the likes. Most of them also come down with renal problems and many more. So let me be a bit comprehensive about artists who work with industrial materials, because a lot of artists actually work with industrial materials. And so an example is a painter. A painter that uses acrylic doesn't actually know that in the acrylic paint itself, there are toxins that can actually affect you when you breathe it. There are toxins that can actually affect your skin when it touches you regularly. So a lot of artists don't know that whenever they paint, they should actually wear a face mask. A lot of artists don't know that whenever they want to make shoes, like the people that actually make shoes, they should wear a face mask. But a lot of artists don't know that whenever they weld, because some artists use welding materials, they should actually wear a face mask, and not just a face mask, they should actually also wear goggles. Some of them start by doing those things, but at the end of the line, they get used to it and then stop doing that. And these things can actually predispose us to a lot of things like skin problems, like cancer, like cardiovascular problems, renal problems, and so on. And I think question and answer time will actually expose more, so that I'll be able to answer your questions and the fears that you might have. But for now, let's move to the next. And the artists that I did not mention. So due to how heavy this topic is with little time, there are other artists or creatives that I might not have categorized. A major general issue with creatives and artists is the substance misuse or abuse. For example, alcohol use, tobacco use, cigarette use. These substances are known to be a lot of risk factors for a lot of health problems. And so Miss Angel is going to be talking a lot more about the mental health aspect of this, I'm sure of that. So I'm just going to be talking about the physical aspect. So a lot of times people actually know that frequent use of alcohol, frequent use of tobacco, frequent use of cigarettes can actually harm us and cause us a lot of health problems physically. And so in general, research has shown that a lot of creatives and artists actually use these things maybe for stimulants or enhancers of their productivity, not knowing that at the end of the day, it can cause a lot of health problems. So how to improve your health? How do you want to improve your health? There are 3 steps that you have to take to improve your health. You have to identify these hazards. So you need to ask yourself questions like, what are the dangers and risks I'm exposed to according to my creative part, according to my skills? What are the things I am exposed to? That's the first way to actually create a better outcome for yourself and for your physical health. So you need to ask that question. The next thing you have to ask is preventive measures. So you need to ask the question, how can I protect myself from risk and hazard? So how can I protect? I'm a software engineer. I work with my laptop a lot of times. And so the lighting on my laptop can affect my eyesight. So how can I protect myself from this risk and from these hazards? And also health monitoring or medical surveillance. So the next step is, how do I see a health professional frequently? Because it is very important for my physical health, because I know that my physical health, if affected, can affect my artistry and my productivity. And so this comes to the end of my presentation. I actually decided to open more time for questions and reactions, so that I can get a lot of questions and then maybe answer them based on my own experience as a medical doctor. If you feel like I didn't touch on some things, you can also please share your comments and I would answer them. Thank you very much.
Thank you very much for that presentation. So does anybody have any questions at all? If you do, please feel free to raise your hand in the just using the hand raising function, and we'll be more than happy to unmute you. If you would prefer that we read out the question on your behalf, then do feel free to ask using the Q&A function at the bottom of this window, and we'll make sure that your question is answered as well. So we have a raised hand from Jogo, so I'm just going to unmute him now.
Hi. Hello, everyone. Thank you for the opportunity. Not sure if it's if my question is in the scope of the presentation, but I was wondering whether you think it's important that there is like social protection, a special kind of social protection for artists in relation to these health issues that we were talking about.
Sorry, I don't understand the question. Please, could you be a bit more comprehensive?
Sure, sorry. I was asking if, I'm not sure if the question is in the scope of the presentation, but while I was listening to your words, I was wondering whether there should be some kind of special social protection in relation to these health issues.
Yeah. I'm a Nigerian, and if I'm going to be answering your questions, I'll be answering it based on my experiences as a Nigerian. Our healthcare system is not so upgraded in this part of the world, and so it might be a bit difficult to actually get a doctor or a health professional that specializes in artist welfare as regards health. And if I'm to understand, I really don't understand your question, but if I'm to answer your question, it would be more, yes, every artist should be able to protect his or herself in order to improve his or her physical health. Like I mentioned before, like when I started, the first thing I mentioned was the fact that without protecting your physical health and without protecting your physical health from risk of health complications, this can actually affect your productivity as an artist. And so it is very important that in all of this, you need to protect your physical health. And how do you protect your physical health? I think I mentioned it in the second to the last slide, by asking some questions so that you can know if you're at risk of health complications that might arise from either your family history or from the skills and the work that you do. And so it's very important that you ask these questions. I don't know if I answered the question.
Yeah, thank you.
Okay, you're welcome.
Thank you very much. Oh, sorry. Thank you so much for your question, Jogo. Innocent?
I do have another question if there's no one else.
Sorry, did you say you had another question?
Yes.
Yeah, sure. Ask away.
So I was thinking if, for example, in arts degrees, there is this, if the program of art degrees includes this kind of concerns with the students, if there's some kind of what is the word? Sorry. If teachers talk about this with students, for example, if there are classes or maybe just like a small introduction in some semester where these topics are raised.
So I'm a medical doctor and I did not go to an art school, so I cannot really answer the question. But I would validate your question by saying that it is actually very important, if schools are actually not teaching this already, to actually start introducing artists into being more conscious of their physical health. So I don't know if Sasiso or Innocent can answer the question, if maybe.
I mean, oh, sorry.
So just quickly add a bit to that, and also to quickly answer the question and also to add a bit. So
okay, I think Innocent's connection is just frozen. but I'll add my kind of like bit to this. I think one of the reasons why I think we have, oh, Innocent's back again. I think. Innocent, can you hear me?
I don't think he's back. I think he's
Okay, no worries. So I'll try and answer from my perspective. So I think one of the reasons why we have something like the drill is because it's kind of addressing maybe some of the things that you as artists or creatives don't normally kind of learn within a formal environment. So at university or art school or wherever. And I think these sessions are a great opportunity for us to kind of learn. It's almost kind of like alternative learning about the things that are most important. From my experience, I know that with a lot of artists that I work with and from myself, from my own studies, we don't really learn, you know, these things in terms of kind of taking care of your health and that sort of thing. I do think it's something that schools and colleges should be addressing. But I suppose it's down to kind of the individual institution as well. So it's really all about whether they can offer that, but I think it's very important. Another thing as well is that my advice is as well is that particularly when you're traveling and you're working with clients, I think it's also good practice. And I think to be able to kind of have conversations with you know, whoever is contracting you, especially if you're in a different country where, you know, kind of like the medical system is a little bit different. I think it's important for you to kind of maybe draw out some things in terms of, okay, where do I go? Do I need to fill out a form? Am I protected for medical care? And I think health insurance is also very important. Yeah. I don't think anybody, especially in this day and age now, if you should be traveling without health insurance at all. You know, most of the time we don't need health insurance. We don't use it, but it's a good lifeline to have, because if anything ever happens when you are away, especially when you're in a completely different continent and, you know, the costs are extortionate. So I think having health insurance is important, but also having that conversation if you are being contracted or commissioned for international work with the people based in the country you're working in about kind of how you're protected. And yeah, and I also, just a little bit of advice as well, is always read, if there's one thing that document that I read so thoroughly, it's an insurance document. Make sure you're getting the right health insurance, which will cover you for the right things. Something that was covered in the presentation were the different types of ways that artists can maybe become ill. And, you know, I think there's this thing about obviously materials that artists use that can be quite damaging for health. So I think even when you're filling out your like health insurance forms, or you need to kind of make sure that you're covered for materials, that kind of thing. So I don't know if that's how helpful that is for you, Jogo, but yeah, I think it's very much about, it's an individual thing, and I think it's down to each country. But I think it's, unfortunately, it's a conversation and something that, from my knowledge, is not kind of practiced as much or kind of emphasized as much in art school or in universities, from my knowledge as well.
Yeah.
Thank you so much.
Great.
Yeah.
So, sorry, carry on.
Well, yeah, just you could talk. I thought you were saying something. You could say what you want to say.
No, it's fine. It's okay. You can go ahead.
Okay, so I was thinking like there could be prompts. Like I wanted to talk. I wanted to have like conversations more than I had the presentation. So I don't know if I could just drop prompts and answer those prompts based on your experiences as artists in the house. So the first thing I want to ask is, for the artists in the house, what do you do, and what do you feel might expose you to ill health? Maybe you are a painter, and the paint you use or the materials you use could have toxins in them, and maybe you not just have toxins in them, can be hazardous to your health, and so on. So the question is, what do you do as an artist in the house, and what are those tools and materials that you use that might affect your health? So I think the question should just go to the general public so that I could answer and then give my expert opinion on your worries.
So what I'll do is, if you just raise your hand, if you would like to kind of share what it is that you do and the materials that you work with, if you just raise your hand in the chat, I will unmute you. Jogo, I'm going to unmute you again, just with regards to your query in the chat, so that you can mention that.
Just wanted to share that in the past I've had problems with due to carrying photography equipment for long hours. I mean, like a tripod and cameras and lenses can be quite heavy, and I've had to go to what's the physiotherapy.
Yeah.
For my shoulder, also in terms of photography, which is what I do. Personally, I haven't had any problems with chemicals, development chemicals, but I've heard that people who spent a lot of time in the dark room can also be exposed to the fumes from the chemicals, and if you don't take the precautions, it can also be dangerous.
Yeah. Okay, so answering that, the first thing that a lot of us would need to know is there's what we call overuse syndrome. And overuse syndrome just necessarily means that you're using a part of your body significantly and causing stress to that part of the body. Do you understand? So it might not be just dancers alone. It might be like an example. For an example, Diogo says that he's a photographer, and so he carries his tripod and heavy materials for a very long time. Of course, that in the long run could actually cause overuse syndrome. And so the part of his body that he uses a lot might be affected. And so there's no way that you actually not go to see a physiotherapist for that. But what can you do prior to that? How can you avoid getting to the point where you actually have an overuse syndrome and then get to the point where you have to see a physiotherapist? One of the things you can do is you can get materials to be able to carry your tripods for you. So maybe you're going for a shoot. You can get a car instead of getting into a bus. Then you put all your materials in the car. That's very easy. It looks like, oh, wow, this is not practicable, but it's actually very easy. From there, you could get bags that you could put all your materials into and then carry it. So a lot of times, I've noticed something about photographers that they get a one-hand bag or a unilateral bag instead of a bilateral bag. If you get a bilateral bag, there's an equilibrium in a place where the load that you're carrying on this part of your body is also the same as the load you're carrying on this part of your body. And so if you're carrying like a bilateral bag, it helps than a unilateral bag for your and so on and so forth. There's a lot of it might be affected. And so people like that are prone to bone problems of the back, like scoliosis and lordosis and a lot of other things. And those are very simple things that you can do. Another thing is you don't have to, like when you get to the shoot site, instead of carrying your tripods or carrying a lot of heavy materials around, you could just drop it at a point of contact. So, okay, whenever you need anything, you go and get it instead of carrying everything everywhere. And of course, even with all these things, you also still need to see doctors regularly, like Saziso mentioned, which is very important. We all need health insurance plans. I don't know how health insurance plans work in your country, but in Nigeria, for example, we actually have very good health insurance plans for even artists themselves. Another thing that you mentioned, which is very important, is the fact that for a photographer, you use dark rooms, and in dark rooms, you use toxic materials to create your images, and it is actually very dangerous. One of the things I would advise is that whenever you're in a dark room and you use toxic materials, you can actually just wear a face mask. A face mask is good enough. You are well protected by protecting your respiratory system from inhaling those toxins. Another thing you can do is you can wear glasses. I don't know if wearing a dark shade can help you see the materials you're trying to print. The reason why that is important is because when you're entering a dark room, you know, you can decide, if you're entering a dark room for a very long period of time, you can actually start having eye problems like astigmatism, eye problems like myopia and presbyopia and a lot of other things, and even eye problems like conjunctivitis, just because you're used to entering the dark room, and then there's a shift where you are in a lighted area, and then you just get into a dark room where there is no light at all. So your eye gets accommodation issues because your eye accommodates quick enough, and so your eye gets used to that quick accommodation, which can be injurious to your eye and then cause a lot of eye problems. So yes, those are like things that you can do. Did I answer your question? Did I add more comments that might help you?
Was that helpful for you, Jogo?
Yes, yes.
Brilliant. And so thank you so much for your question. Does anybody else have a question or would like to share their practice so that he can give maybe some advice on how you can maybe take better care of your physical health?
Yeah, I think there's a question. I just saw a question now. And the question is, I highlighted two things, sitting and eye problem. So yes, if you're sitting on with your laptop or your computer for a long time, it can affect you. It can affect your physical health. And I will start by explaining a little bit about sitting. And so when you sit in a position for a very long time, it can affect your back. It can affect your bone, the bone that makes up your back in general. So how do you want to help yourself by not getting to that point where you start having back problems? It might not start now, but then it's a very, very active complication to people that actually sit in a place for a long time. One of the things you can do is before you sit, you can exercise your back, you can stretch, you can do some stretch exercises, and then you sit. When you sit for more than an hour, it is advisable that you stand, and then you actually, like if maybe your work makes you sit for maybe 5 hours every day, what you can do is that before you sit, you stretch, you do some stretch exercises, then you sit. Then an hour after sitting, you also do that same stretch exercise. And so for every hour that you sit, you do the stretch exercise. Do you understand? That way your body gets used to, like your body doesn't get rather used to an overuse syndrome. That's one example that you can do while sitting. Another thing you can do is you can sit so a lot of people don't know how to sit. There's a proper way you actually sit. You sit with your back resting on the chair or whatever, maybe it's chair, or make sure that you have a backrest. A lot of people don't actually have backrest whenever they want to walk. So when you're walking, you make sure that you sit having a backrest, and then your back must be what will I say now? Must be parallel to the backrest, and so you must make your back same, like it must be parallel to the backrest. That's another thing that a lot of people don't know. So you see some people sitting with their back diagonal to the backrest. In the long run, it can affect your back. So that's for sitting. For eye problem, and so a lot of times people don't know that your screen brightness is very important. So two things you can do is you can reduce your screen brightness. Instead of having it at 75% or 100%, you can have it at 50%. That's for your screen brightness. Or if you know that, okay, you can't actually see well without having your screen being bright, you can actually get a screen protector. And so it protects your eyesight from the light that comes out from your maybe laptop. It might actually not be your laptop. It might also be your phone. It might be your iPad or your tab or any other thing that actually we all know that can affect our eyesight. And so the problem is not that you can't use your laptop, you can't use your phone, you can't use this and that. It is that you're using it for a very long time, and so it can affect your eyesight. So how can you prevent overuse to now cause a problem to your eyesight? You can reduce your screen brightness, you can get a screen protector, you can also stand up sometimes from your screen, just like if you're sitting there for a long time. Like when you're doing your stretch exercises, is a good thing that you actually go out to stretch, because it also protects your eyes from having accommodation problems with the eyes. So I don't know if I answered that too.
Thank you very much for that. I think the person who asked the question was Ayodeji, so I'll just unmute him just for him to confirm that that answered their question.
Hello.
Hi.
Yes, thank you. That was really helpful.
Okay.
Fantastic.
So,
and oh, sorry, carry on.
Yeah, I wanted to say I think my time is up. So let me just conclude by saying that we're in a precious time where we're actually experiencing a pandemic. Pandemic happens every 100 years, and so I would advise that you don't take risk as regards this pandemic. Follow all the guidelines that the World Health Organization has given us. Also follow the guideline that your country health organization has given you, or your state health organization has given you. If you are to wear a mask when you're going out, please wear a mask. If you are to wear a face shield with your mask, please do. Please try as much as possible to follow the social distancing rules and just stay safe. Yeah. So I will be sharing my contact with Innocent and Saziso. So if you want maybe an online health management, you can reach me anytime. So I will you just book online, you fix a time. I see you as regards that time. If I need to refer you to get some medications, I'll refer you to get some medications. If I need to refer you to a hospital, I'll refer you to a hospital. If I need to refer you to do some tests, I'll refer you to do some tests. So thank you very much.
Thank you. Thank you so much for your